Developmental stimulation is the key to improving the developmental outcomes in children with developmental delay, particularly cerebral palsy, and it is an effective proven therapy for the same. Knowing about the basic steps of developmental stimulation will empower parents and caregivers in the stimulation of their children's overall development. Developmental stimulation aims at simple activities that can be done by parents at home, which help arouse and stimulate your baby's sense of sight, sound, touch, taste, and smell. Also, in children with developmental delay, simple activities and passive exercises help in achieving skills in the order which they appear. Certain principles of developmental stimulation should be kept in mind. Choose a stimulating and peaceful environment for the child. Child should not be hungry or not immediately fed. Avoid performing stimulation or activities during periods of stress. Activities should be appropriate for the child's developmental age. Introduce new skills as the child achieves the old skills. When performing an activity, engage with the child verbally. Praise the child each time as he succeeds or tries hard. Now let us learn how to provide multimodal sensory stimulation to the baby. Among the modalities of sensation, visual stimulation is one of the prime sensations. Let us learn how to stimulate the baby visually. This is especially important for the babies who are visually impaired. Show multiple and bright colored objects. Move the object in all different directions. You can also use the mobile touch in a dark room and help the baby improve the visual fixation and tracking. Now let's learn how to provide tactile stimulation to the baby. In this video, let us learn how to provide tactile stimulation. This helps the baby to improve the ability to feel and touch objects. Open the palms of the baby and make the baby feel the objects of different nature and different items. Simultaneously provide multimodal stimulation by using those items to produce sounds, and you can also use spinning objects, spinning lights, which also helps in providing visual stimulation. Auditory stimulation. Let us learn how to stimulate the baby's auditory skills. Use various objects of different sounds of different nature and produce the sound from both sides near the baby's ears. Also, engage verbally with the child whenever performing any activity.
Fatima itu. Oh Fatima. Fatima. Oh gitu. Fatima. Lelo. Lelo.
Now, let us learn how to provide oro-motor stimulation, which helps in improving the baby's oro-motor skills. Can also help in improving chewing and swallowing abilities. It also helps in decreasing drooling. Keep the baby's head fixed by placing a rolled towel around the head and gently tap around the mouth area in a repeated, gentle fashion. You can also use both your closed fists and perform massaging over the cheeks. In this video, let us learn how to stimulate the child's hand-eye coordination. Place a stand with different toy items hanging from it. Stimulate the child visually by moving or rocking those colorful items in the front of the child, and also facilitate the hand-eye coordination by helping the baby touch those items with his or her hands. Let us learn some important different carrying positions in the baby. Carrying the babies in this position helps him achieve neck control, help the knees and hips to relax. Now let us learn how to provide passive stretch exercise in improving baby's tone and preventing development of contractures. Place the baby comfortably on a flat surface and hold the baby's ankle from below with one hand and gently push it upwards and keep it in the upright position for some time, and repeat the activity again few times before alternating to the opposite side. Similarly, in the same position, bend the knee at right angle and fix the thigh with one hand and ankle with the other hand and extend it few times. All these exercises should be performed on both sides, alternating every time. Place the baby on a flat surface comfortably and using both your hands, hold on to the baby's hips and stimulate the baby's back by tickling. This helps the baby in lifting the pelvis when he tries to do so. Hand opening. This is particularly helpful if the baby has persistently closed fists. Using both your hands, hold the baby's hand, stimulate the back of the hand, alternatively stimulate the fingers as if trying to open them. Insert your fingers in the palm and touch the baby's fingers onto his mouth. Also, you can hold the palm and flex and extend the palms alternatively for a few times. You can aid in the neck holding of the baby by lifting the baby by holding onto both the baby's forearms. If the baby has significant neck lag, and you can hold on to the shoulders and lift the baby similarly. If the baby has good neck control, we can perform forearm weight bearing. Hold the baby from the back through his chest. Hold on to the baby's forearm and place the hands over the surface and help the baby move forward. You can also place an attractive object that will stimulate the baby to reach for the object. Babies who have achieved neck control, you can perform activities to improve the truncal support. Sit behind the baby and make the baby sit in front of you by holding his trunk. You can also make the baby sit on your lap and bend his knees and help the baby achieve squatting position. Before we come to the end of the video, let us learn some points to be remembered. You can perform activities using simple things at home, but those activities should be appropriate for the developmental level of the baby. Do as long as the baby enjoys. Avoid overdoing. Talking, touching, caressing and kissing matters a lot. Praise the child every time he performs. Thank you.